According to the CDC, the Center for Disease Control and Prevention, there is one preventable factor in the top 4 leading causes of death in the United States. These causes of death account for almost 1.5 million deaths per year. A common factor here is smoking tobacco. Quitting smoking is extremely important to your health, and it is doable with a combination of methods we're going to get into. I want to talk a little about the risks of smoking and how you can go about quitting. So first of all, some more statistics about the risks, also from the CDC. The leading cause of death is heart disease. Smoking makes you 2 to 4 times more likely than non-smokers to come down with coronary heart disease. Second highest is stroke. Cigarette smoking approximately doubles your risk of stroke. The third is cancer. Lung cancer is the leading cause of cancer death, and almost all cases are from cigarette smoking. It causes about 90% of lung cancer in men and 80% in women. Compared to non-smokers, men who smoke are about 23 times more likely to develop lung cancer, and women are 13 times more likely. The fourth one is chronic obstructive pulmonary disease. That involves chronic bronchitis, which is a cough with mucus, and emphysema, which is destruction of the lung walls. Unfortunately, this is irreversible, which is very scary. More than 90% of these deaths were attributed to smoking. It is associated with a 10-fold increase in the risk of dying from chronic obstructive pulmonary disease. Another thing to keep in mind is that smoking doesn't just affect the smoker, it also affects people around the smoker due to secondhand smoke, which is breathing in the smoke from other people. It increases heart disease risk by 25 to 30% and lung cancer risk by 20 to 30%. So obviously the best thing is not to smoke at all, but if you have become addicted, there are ways to deal with it. Mayo Clinic has a list of various methods that can be used to break addiction. First of all, there are nicotine replacements. There are some that are available over the counter. There's a patch that goes on the arm. There are lozenges you can take in the mouth, also nicotine gum. There are also prescriptions. There's a nasal spray that goes in the nose. There's an inhaler. And there are also some medications such as Zyban and Chantix. Some other ideas are to have something to keep your mouth busy. You can chew regular gum. You can chew crunchy vegetables like carrots or celery. You can chew nuts. Other ideas are to get counseling or a support group. Doesn't even have to be anything professional. There are support groups online. You can also use a family member or friend to help talk you through your cravings. Another important thing is to get exercise. Also, relaxation techniques are good to learn. Often, cigarette smoking is taken up as a way of dealing with stress. So, alternate relaxation techniques can help avoid having to come on to cigarettes. Some ideas here are yoga, meditation, hypnosis, and massage. Now, some studies have found that combination of these methods work best. There was a report from the U.S. Department of Health that showed that medication and counseling is more effective than either of them alone. There was also a report in the Journal of Women's Health. They used a 3-prong approach. They used a nicotine patch on the arm, they used exercise, and they used counseling. And they showed that they were able to reduce tobacco-induced cardiovascular damage within 3 months. So these are some of the ways that can help you quit. So let's discuss what actually happens when you quit. There's a New York Times article that goes through the various stages of recuperation. Within 8 hours of quitting, your blood carbon monoxide and oxygen levels return to normal. Within 24 hours of quitting, your risk of a heart attack goes down. Within 48 hours, your nerve endings regenerate and your sense of smell and taste go back to normal. Within 2 weeks to 3 months, your circulation improves, walking becomes easier, your lung function increases by 30%. Within 1 to 9 months of quitting, your energy level increases. You lose things like nasal congestion, fatigue, shortness of breath. You have fewer illnesses. Within 1 year, your risk of coronary disease is half that of someone who's still smoking. Within 5 years, your lung cancer death rate goes down by half, and your risk of cancer of the mouth as well. Within 10 years, your lung cancer death rate becomes similar to that of someone who never smoked. Precancerous cells are replaced with normal cells. Risk of stroke goes down, close to that of a non-smoker. And also risk of various cancers, mouth, throat, esophagus, bladder, kidney, and pancreas also go down. So now you know some of the risks of smoking. You know how quitting benefits you. And we've talked about some ways to help you quit. So you can use these techniques to get your mind off smoking. You can get support. You can talk to a doctor for prescriptions if you have to. The important thing here is not to lose hope. It may be hard at first, but if you stick with it, you can greatly improve the quality of life both for you and the people around you.